Seniors. Every senior in this nation that's on Medicare is able to get a free annual checkup. And ladies and gentlemen, you need to understand in your arguments that that free, affordable annual checkup has reduced the cost of medical care in Medicare programs. And the inflation rate in Medicare has come down since the Affordable Health Care Act has gone into effect. And the statistics you toss around about the extraordinary cost, you need to understand that we have been plagued by health care insurance inflation for decades. And the Affordable Health Care Act has built into it the very first opportunity this nation has had nationwide to bend the cost curve on health care. And we're seeing it happen today. We're seeing it happen today in the Medicare program, because seniors are able to get prevention. They're able to get that drug that brings down their blood pressure, or the advice on how to deal with diabetes and avoid the extraordinary cost. Oh yeah, 37 times repealing the Affordable Health Care Act. You talk about jobs in America. Okay, let's talk about jobs in America. Let's talk about the fact that there has not been one significant piece of legislation out of this House since the beginning of this session to create jobs. President Obama stood here on this dais and talked about creating jobs. But this House has not brought forward one significant piece of legislation. The President called for an infrastructure program, $50 billion, to put people back to work, to create the infrastructure, the streets, the roads, the bridges, the water systems, the sanitation systems. Not just to put people back to work, but to build the foundation for future economic growth. So where is that legislation? Has it even been heard in one committee controlled by our friends in the opposition party? No. No. Well, we will take up a Transportation Act soon. But will there be adequate funding for infrastructure? Probably not. Probably not. The President called for an American Jobs Act. Not even heard in committee here. Americans want to go to work. They want jobs. They want to go to work. And we have a program on the Democratic side to do that. And we want to deal with the big problems facing this nation. We want to deal with the fact that we have millions of people that want to work in America. And we have serious problems to solve. We ought to put aside this business of repealing the Affordable Health Care Act. Change it? Yes, make a reasonable change, and let's talk about it. Make a proposal about how to make it better, and we'll talk about it. But we're not going to talk about repealing it. We're not going to go there.